Well, thank you all for a great day, and I have been instructed by some folks to make this very short because while John was between you and lunch, I'm between you and both the end of the day and hopefully some wine. So I'll keep this blessedly brief. So today, I think as we can all recall, we talked about genesis of neonatology and the genetics. We talked about congenital diaphragmatic hernia, ILD, and BPD. And I think that it's pretty true that we've woven a thread of genetics and surfactant, which is kind of hard to do with a detergent, through the course of the entire day. That was a metaphor, everybody. But you'll also recall, thank you, Ross, you'll also recall that we proposed to test a few hypotheses at the start of the day. And the first was that progress occurs at the margins of disciplines previously thought to be distinct. And I think I'm just highlighting a few of the speakers who really brought that out in quite an illustrative fashion. You can see from Dr. Sunshine's presentation and Dr. Nogi's and Dr. Blumenfeld's and Kristen's, Dr. Quo's, that we really did move from one discipline to another to make tremendous progress. Another postulate that we tested was the notion that context and narrative enables durable and reproducible knowledge. And I think, truthfully, John Kinsella's story about CDH, particularly how he's watched it and cared for these kids over so many years and changed his perspective based on what he's been able to see clinically, is a great example of that. I think also Dr. Elvira's perspective on inflammation being or NF-kappa B having a developmentally regulated role is also one that illustrates the whole idea of how important context might be. And I think there's nobody currently in the galaxy of pediatric pulmonology and perhaps neonatology that more well exemplifies the idea that discovery drives care and that care drives discovery. And I think that Lisa Young's work and Mike Tracy's work underscore that notion as well. There are a couple of questions yet that we should think about, that we should think carefully and prudently about. First of all, I think we've heard a lot about thin phenotyping, and really, have we done our best? Have we done what we need to do to craft phenotypes that are sufficiently thin to really permit us to answer and ask questions that will be meaningful? Because if we don't have really thin phenotypes, we're going to keep asking questions and getting answers that are probably not really quite true. Second, I think that we should consider which dogmas should be revisited. Throughout the course of the day, there were many dogmas that were presented that we spoke of. I think John Kinsella's idea that it's the left ventricle that's the problem, not necessarily the lung parenchyma that's the problem in CDH, is a perfect example of whether we should revisit that particular dogma. Pretty much everyone today talked about some aspect of care, be it a lung biopsy or be it should we be getting genetic testing on everyone. Should those dogmas be pursued, or should we kind of throw some away and think about starting over? And then one really critical issue that we have to give real consideration to now is how quickly can we and how quickly should we translate these discoveries? We heard about the 22-year hiatus between the obstetricians adopting prenatal steroids from the evidence. We also heard about the tracheal plug. There's all sorts of gene editing therapies that are coming down the pike, and there's also a lot to consider relative to exosomal therapy and replacement therapies that we're going to see. And we shouldn't delay, but we shouldn't hurry overmuch. Finally, this has been a wonderful day, and I'd like to just take a moment to, first of all, thank the staff from the Pulmonary Center of Excellence. I really would like to call out Tristan Puesa, who's in the back, and Tristan did a wonderful job with every aspect of the scheduling. I think the faculty knows that, the speakers. I'd also really like to thank Lara Vastano, who did just a wonderful job helping make the day work, and Lana as well. This has been, as I pointed out with Paul King, the CEO is here earlier, it's been a tremendous partnership with Lucille Packard. They've supported us 100%. and that includes giving us an outstanding PR person who's helped with every aspect of the event from a PR perspective, Amy Brooks. Also Kathy Van Camp, who is on my dyad in the center direction. And then I'd also like to thank each of the organizing committee members, especially Christina Elvira, Bill Bennett, Susan Hintz, Kristen Kuo, Ross Metzger, Carlos Mila, and Mark Nichols, who played a key role in helping get this day rolling. And I'd like to thank you all for staying throughout the whole day, and I invite you now to enjoy some refreshments at the end of the day. Thank you all so very much.